run you through some housekeeping rules. Please use your headphones if you have them, and also please introduce yourself in the chat box. Try and put in your name if you're a student or a parent and from which city you are, so that we'll know you that way. And also please do mute your microphones, and we will have question and answer sessions after all the presentations, after the session. So I'll introduce you to all the speakers that we have today and how we're going to do this session as well. So we have three universities that are participating for today's session. I will introduce EducationUSA very briefly, and then introduce you to all our panelists. We have on board today School of Dentistry, University of Louisville, and we have Troy University, School of Nursing, and then we also have Keck School of Medicine, University of Southern California. Before we begin the session today, let me just very briefly introduce you to EducationUSA. So we are supported by the US Department of State. We are a US Department of State network, and our mandate is to provide accurate, comprehensive, current, and if I may also add, unbiased information on US higher education. We are present in over 170 countries with over 400 centers, and in India we have 7 centers, and I will also be sharing all the details of the 7 centers in India, so you can reach out to the center closest or nearest to you. So at EducationUSA, what we have done is we have divided the whole application process into 5 simple steps. And first one is researching your options. Second one is finance your studies. Third is completing your application. Fourth is applying for your student visa. Fifth is preparing for your departure. Now, it is important that you understand you could be at any of these steps, and you can approach any EducationUSA center. For example, we work very closely with the consulates and embassy where we have visa sessions, or if you're filling in your applications, if you have doubts about that, we provide a lot of services. Please visit our website. I will pull up our details so you can access what are the services that we will be providing in a bit. And how do you connect with us? These are the options. We have a mobile app, both on iOS and Android platforms. So please download that EducationUSA India app. And we are present on all social media. So please make sure that you follow us on Facebook and other platforms so that you will be updated about our events as well. Now, on your screens, you can see the services that we provide. I would encourage you to please take a screen grab of this so that, you can come back to it later as well, or the links, and you also will have our contact details. So you can definitely use these services from us. So you can request for a free virtual session, and also you can have a one-on-one advising session as well. And we also offer individual advising membership, where you will get a host of services, in-depth advising for your various higher education needs in the US. So without much delay now, let's also, this is our contacts slides. Again, please take a screen grab of the slide, so that you can come back to it. And also we will share these links, and please visit our website www.usief.org.in where you will also find all these contact details too. Now, today's session is part of the Discovery series that EducationUSA India is organizing. It is a 7-part series, and today we are focusing on health fields in the US. And, we have different sessions also coming up, which also I will share at the end of this presentation and the session, so you can choose if you are interested in other fields as well. And today we will be focusing on medicine, dentistry, and nursing programs in the US for both undergrad and grad as well. So now, without much delay, let's get into the details of our presenter. So let's begin with the dentistry first. So we have Dr. Alma, who is the interim assistant dean, and Jamie Campbell, who's the coordinator of admissions from School of Dentistry, University of Louisville. Thank you so much for joining this session today, Dr. Alma and Mrs. Campbell. So I will introduce both the speakers to you now, and then I will hand over them to start off with their presentation. So Dr. Alma Tosukovic is an associate professor in the School of Nursing and serves as the is associate professor in the Department of Comprehensive Dentistry at the University of Louisville School of Dentistry, and recently she's appointed interim assistant dean for student admissions and student affairs. She has completed her undergraduate training at the University of Sarajevo, and in 2002 graduate of the University of Louisville School of Dentistry. After 7 years as an associate in the private sector, she has joined University of Louisville in 2009 as a full-time faculty member. She has several different appointments here in school, and to name just a few, she was a team leader in one of the integrated D3, D4 cleaning groups for 9 years, and co-course director for Integrated Clinical Sciences 1 and 2. And I would also welcome Ms. Jamie Campbell, who is the Assistant Director of Admissions at the University of Louisville School of Dentistry, and she has worked in the dental school admissions for 5 years and higher education for 14 years at the institutions in Florida and South Carolina. She has a bachelor's degree in dental hygiene, and she's currently pursuing her PhD in counseling and psychology with a focus on college student personnel. So I would now request Dr. Alma to take over and begin our session on studying dentistry in the US, and then we will move on to other aspects and we will take your questions.
Good morning, everybody. Well, good morning here from Louisville. I know we're in different time zone. That's why this is so cool. Let me share my screen with you. I hope you can see this. Can we see this, Suhail?
Yes, Dr. Alma, we can see this.
Thank you very much. So welcome to University of Louisville School of Dentistry. I'm here joining with Ms. Jamie Campbell. She's, as Suhail said, our Assistant Director of Admissions, and she's going to introduce you with admission process here in School of Dentistry. We're coming from beautiful city of Louisville on Ohio River in the state of Kentucky. And we have a long history in graduating competent beginning dentists here in the United States. I want to introduce a little bit about our school. Our school is located in a health science campus. And University of Louisville has 3 campuses, has a main Belknap campus, has health science campus, and also Shelby campus. Here at the health science campus, we have University Hospital, obviously dentistry, and we house dental hygiene program as well. We have School of Medicine, Nursing, Public Health, and we also have a faculty practice. So every faculty member that's employed by university full-time has an option to practice. So we're all actually active practitioners. I as well practice 1 day a week in my private practice. So this is our goal. This is what we're all here for, to graduate beginning safe, competent dentists. Our graduation rate is very high, and we're always going to maintain it that high. That is the reason we are very picky in our process of selecting candidates. Let me introduce you to our incoming D1 class. They just started in this horrible, unprecedented time in this COVID pandemic, but we started them on time, and they're here actively participating in our curriculum. We usually receive over 2,000 applications every year. So as I said, we're very selective, and we carefully selected from that pool. Last year, we received 2,059 applicants. And this class is a little bit unusual. You know, dentistry used to be predominantly male profession. Then we started kind of equaling out. Well, look at this class. We have 74 females and 46 lucky guys. The average age in this class is 23, but we are very diverse in every aspect, and we are very proud of that diversity in our school. So even in age, we are very diverse. So we range from 21 to 50. We have 22 states represented in this class and 14 countries. So 20 students in this incoming class of 120 were born outside United States. They come to us from 68 different colleges and universities, and 15 students come to us from racial and ethnic backgrounds that are underrepresented in dentistry. This chart down gives you a little breakdown on average academics from this current class. And obviously, these figures changes from year to year, but we try to maintain them as high as possible. So this is just a little schematic representation of all the states that are here represented in that incoming class, and also all the countries where our students were born in. So let me give you some fun facts about our school. First class of 10 dentists graduated from this institution in June of 1887 with DDS degree. You know, in the United States, we award either DDS or DMD degree. They're really interchangeable, but some schools are very stuck with their original program. So DDS is the Doctor of Dental Surgery, because they consider us surgeons as well, because we cut on hard and soft tissues. So we here at Louisville award the DMD degree, which is the Doctor of Dental Medicine, and that started in 1939. Since then, more than 8,000 of our students graduated from the institution. And I also mentioned at the beginning that we house dental hygiene program, and we're very proud of it. So we graduated more than 1,100 dental hygienists from the ULSD. In 1970, the school really expanded into the present new facility, and this present new facility became kind of tight for us too. So we expanded in 2011. We underwent this big renovation, which lasted for 21 months, and it cost us $45 million, but we have this beautiful facility now. And the interesting fact about it is that all classes and clinics were operational through this time. None of it was lost. So we're very proud of that fact. Even through this COVID pandemic, we never stopped any days. We were operational. Students, of course, were not here, but faculty maintained the operation of the school because our patients needed us. In 2007, I mentioned this dental hygiene program. In 2007, we started awarded a BS degree through the School of Dentistry. And we have here in the United States over 300 dental hygiene programs, but only 37 award this degree, and we are one of them, and we are very proud of it. Every year we receive, I said, over averages about 2,300 new applications, and we only have 120 spots available. So what skills do you need to become a good dentist? You obviously need to be good in your academic courses because it's very important. You're not a technician, you're a doctor. So you need to have a really high good scores in basic sciences. You need to think critically, obviously, because every patient is different and we tailor our treatment to every patient differently. We say we're person-centered. We offer person-centered care here at University of Louisville. Obviously, you have to be good in ethical reasoning. You have to be committed to serving others. You have to be a team player because nothing is going to happen without your team. You have to be sensitive to patient needs. We're very committed here to establishing cultural competency. And obviously, that's not one-time deal. That's ongoing thing. So you have to learn with every patient that comes your way. You have to be good with your hands. So that's the reason in our application process, we concentrate on all activities that you might have and that would exhibit that manual dexterity. You have to be really good in communicating because 50% of your treatment is going to be good communications with your patients. Obviously, for those that don't have a native language, it's not English, you have to pass the TOEFL exam in order to be admitted to the dentistry program. You have to be very creative and you have to be responsible. So with that said, I'm going to turn it over to Ms. Campbell, and she's going to introduce you the application process here at University of Louisville School of Dentistry. Jamie.
Thank you, Dr. Alma. So there are, I know we have a wide array of people on this who are in different stages of their education. And so we wanted to talk about two different paths on entry into dental school. So for our high school students on the call, we have an early acceptance program. And this is, I wouldn't say it's common around the US for dental schools, but there are several schools that have a program like this. And so we actually guarantee, I use the word guarantee because you have to still meet certain requirements after you're admitted, but we'll have an application process and an interview process for high school seniors who can apply to the University of Louisville and have early admission into dentistry. So essentially, you are guaranteeing your spot in dental school. You don't have to compete for a spot in dental school at the time when it's time to enter our program. So some of the requirements of that, you have to go through an interview. You also have to attend undergraduate education at the University of Louisville and maintain a certain GPA. And I think that's on the next slide. So that's that option is open to high school students. So again, that application process is happening now for high school seniors. The deadline to apply for that is December 15th. And then we also have our traditional path. So for those of you who are pursuing a college degree, wherever you are, the traditional path is that after you obtain a college degree that you would go to dental school after that. And that is what we call the traditional path. So you would apply to dental school in the US after you already obtain a college degree, or an undergraduate degree is what we call it here in the US. So those are the two paths of which students can be admitted into our dental school. That might vary for other dental schools, but for ours, we do have that early acceptance, and then we have the traditional method. You can go to the next slide. So let's talk about the ULEAD, which is the University of Louisville Early Acceptance into Dentistry. So the requirements to apply is you must have a 3.75 GPA. We accept either the ACT or the SAT, so you must have a 30 on the ACT or the SAT equivalent of that. All of the international student requirements are listed on the University of Louisville's undergraduate admissions website. So these are in addition to what you would have to meet for just general U of L requirements. You have to submit 2 letters of recommendation, and you must have a minimum of 12 hours of general dental observation. So for those of you who are considering a career in dentistry, we expect that if you're going to apply to this program, that you've already done some career exploration and observation of a general dentist. So that would not be an oral surgeon, that would not be a dentist who only does specialty, but someone who does general dentistry. I think that you can see we have an essay, and you can see the application process that all goes through our undergraduate admission. So a reminder for this is that you have to attend undergraduate at the University of Louisville. Go on to the next slide. Once you are in the ULEAD program, you must maintain a 3.5 GPA. So while you're at U of L, you have to take the DAT. So that's the dental admissions test that Dr. Alma was mentioning before. You have to have scores at or above the national average. And then there's just some other things we expect you to do that are pretty minor in comparison to what you would already be doing if you were wanting to gain admission to dental school. All right, you can go on. So what are the prerequisites for getting into dental school? So we're past ULEAD. This is if you are attending college. You must have a minimum of 16 hours of biology work. So if you remember back to what skills do I need, the first bullet on there was an aptitude towards basic science. So you can see that all of these prerequisites are sciences. When in college, you're going to take other, and of course, it depends on your degree. You may be taking some other courses that are not science related, and we want those, but our specific prereqs are going to be in the sciences. And so when we're talking hours, these are US credit hours. So if you are an international student and you're applying to dental school in the US, you would do something called a credit evaluation. We accept ECE and WES, WES. Those are the two that our university accepts, and they will evaluate your credits to see how they translate into US credits. So these are US credit minimums. So we require a 16 credit hour minimum in biology. And then if you go down to chemistry, we require 8 credit hours of general chemistry and 8 credit hours of organic chemistry. And then physics, 1 semester, 3 credit hours. Biochemistry is the same, 3 credit hours. So a little bit on this, we've seen a lot of international students come in and they already have the international bachelor's degree, and they want to know if their credits will be acceptable at our dental school. We will accept international credits. Not all dental schools will, but I will say that there are times when we have seen a bachelor's degree and usually they have a ton of biology that does translate into US, but I have yet to see an international credit evaluation that meets our chemistry requirement. It doesn't mean it's not out there, but I have yet to see one. And so usually that may mean that if you want to go to dental school in the US, that you might end up taking some credit hours in the US as well. And I know there are some dental schools that require some of their prereqs be completed in the US. So it really just depends, and that's something that you would need to research on your own if you wanted to attend dental school. Okay, you can go on to the next slide. Some other requirements for, there you go, for admission, shadowing. So I mentioned that for the ULEAD program, going into dental school, it's a choice, and it's an important life choice you're making. So we want to be sure that the applicants that are coming in have done their share of career exploration. So that's a minimum of 40 hours in general dentistry. We're going to look, this is the holistic part. So this is us looking at everything else besides your grades and those numbers. So we're looking at your experiences, any work, any volunteerism, community engagement. We're looking at life skills and any achievements that you've had. So all of that other stuff that you would put on a resume or a CV or any type of application, that's what we're looking at. We also require, it's called Casper, which is an online situational judgment test. And that assesses for non-cognitive skills and personal characteristics. We also require Snapshot, which is an online, we've had to adjust a little bit in this virtual environment. So Snapshot is an online interview, essentially. We do our own interview, but that's just an additional tool that we are requiring our applicants to do. That's new this year. And then we require specific minimal technical skills. I mean, those are available on our website that are cognitive and technical skills that are required of someone that wants to go and practice dentistry. And then we have an interview, of course. Currently, we're doing those virtually. I don't know what the future holds for us in that, but it's shined a light on what we are capable of. And so I think that's pretty cool. And, it allows us to do things like this, and has forced us to make some changes. So currently they're virtually, but in the years past, we've done them in person. So I'm not sure what the future will hold after that. And I will turn it back over to Dr. Alma.
Thank you, Jamie. Thank you very much. So now you know what it takes to become a student here at University of Louisville School of Dentistry. I'm going to just ask you to just have a little bit more patience to tell you why would you become a student here. So as I said, we have a long tradition. We have over 135 years of experience in dental education. We have excellent reputation for graduating safe, competent, beginning dentists. We are CODA accredited school, so Commission of Dental Accreditation grants us every 7 years, comes here and visits us and grants us a new accreditation. And we are currently accredited through 2023. That's when our cycle renews. We have a lot of experience, clinical clinicians, active clinicians, caring faculty, and we dedicate a lot of money to research because we think we need to be on the forefront of that. Okay, I just cannot reason. There we go. Okay, so we have quite a lot of points of pride, but just to mention a few, as I told you before, we renovated our clinics in 2011. So we have a state-of-art clinics. We have integrated dental curriculum. I don't know if you're familiar, but United States, in order for you to get a license, you had to have passed National Part Board 1 and 2. Now it's integrated, and we mimic that through our curriculum. So we integrate our dental curriculum. We have state-of-art technology, obviously research. And I said, we're actually 15th in NIH funding in the United States. We offer all exposure to all 7 graduate programs, which is not as really frequent in US dental schools, but we do house all 7 specialties. We offer great student support. I told you our graduation rate is high, and we maintain it high because we are going to be watching you from day one, and we want you to stay on top. So if we see you trailing behind, we're going to offer student support. And we're also very proud that we're 21st of 67 schools in the United States in prestigious Shanghai ranking list. We offer patient-centered care. As I say, our curriculum is integrated, but we also integrate you as a group. So we integrate you from the D1 year through D4 year. We also offer community involvement through different clinics and international learning opportunities. So this is the city we're located at, very beautiful city, big enough to satisfy the big city living and small enough to give you the small city living. This slide, my last slide, I'm going to part with this. This is our contact information. You can take just a snapshot of that. Email is preferable, but we have also a phone number if you want to call. So I'll take the questions at the end. Thank you very much.
Thank you so much, Dr. Alma and Mrs. Campbell. Now, we will come back to the questions. I request everyone attending the session to put in their questions in the chat box. If you have any questions, we will come back to them and take those questions as well. Now, let's move on to the next segment, which is on nursing, and then we will move on to medicine. So now I invite Dr. Brittany Armstrong from School of Nursing, Troy University, and Dr. Kelly Whitted from School of Nursing, Troy University, to speak about studying or pursuing nursing in the United States. Thank you.
Good morning. I'm Dr. Brittany Armstrong, and I am the BSN coordinator in the School of Nursing at Troy University. And Troy University is located in southeastern Alabama. We do have multiple campuses at Troy. We have our main campus where most of our traditional students attend, and we also have campuses in nearby Phoenix City, Alabama, Montgomery, Alabama, and Dothan, Alabama. For the Bsn program, for our undergraduate nursing program, we are located both on the Troy campus, which is our main campus, our residential campus, where many of our students, our international students, come and study. And then we're also located on our Dothan campus, which is approximately 45 miles south of our main campus. And it is more of our non-traditional students, our second degree students that attend our program located on the Dothan campus. The BSN program will prepare you for a Bachelor of Science in Nursing. The goal of a BSN program is to prepare entry-level registered nurses to practice in a variety of clinical settings. Upon graduation from our BSN program, you will be eligible to sit for the NCLEX RN exam, which is the standard national registered nursing exam, once you have completed and graduated and met the requirements of the program. Our program is accredited, which is really important for all students that are looking to attend a nursing program. With accreditation, this means that our program is meeting certain state and national standards that are set by our different accrediting agencies and also our boards of nursing. We are accredited by the Accreditation Commission for Education and Nursing, also known as ACEN, and we have full accreditation for 8 years. They visited us last February, and we will expect a visit in approximately 7 years. We are also approved by the Alabama Board of Nursing, which is required for all nursing programs in the state of Alabama. Some career opportunities. Obviously, this is not an all-inclusive list. When you graduate and are licensed as a registered nurse, you are able to practice in a variety of settings. And you can see here, most of these are considered inpatient or hospital areas of nursing, but you are also able to work or practice in outpatient areas, outpatient clinics, home health, hospice, many of those other areas of nursing. These career opportunities, medical, surgical, obstetrics, pediatrics, these are all areas that you would attend clinical in during your 5 semesters in the nursing program. So you would actually have experience in these areas and be exposed to these areas while a student in the nursing program at Troy. The Bsn degree at Troy University does take 4.5 years. We tell our students when they are admitted as an incoming freshman out of high school that it will take them approximately 4 semesters to complete the undergraduate academic courses in preparation for the Bsn program. Once the students have completed those 4 semesters or those academic courses, then they are eligible to apply to the actual clinical sequence of the Bsn program. Once accepted into the Bsn program, students will attend classes for 5 semesters. We do not attend classes in the summer. Summer semester here at Troy University is about 5 weeks shorter than our traditional fall and spring semesters. So we have found that it's that our students are more successful that in the longer semesters, the traditional semesters versus summer. So we now encourage our students to seek out externships or internships in our local facilities during the summer in areas that they feel like they may be interested in working when they graduate from the program. And we have a lot of hospitals, and we have many students who have performed these externships locally in the state of Alabama, and we had several this past summer that went to Duke University and completed some externships. Nursing programs in the United States have become very competitive, and it's no different here at Troy University. We encourage all of our students to have a very strong competitive GPA. Our minimum GPA to apply is a 2.5 on a 4.0 scale, but we do tell our students that that is the minimum and doesn't guarantee that you will receive a seat in our program. We have found that to have a competitive GPA, we are seeing much greater than a 2.5. Usually a 3.3, 3.5 GPA is what we're seeing for that receive admission or receive a seat in the program. We do calculate all hours attempted, so any college credits that our students have completed are calculated in their cumulative GPA for admission. We also have an admission essay that the topic is given to the student on the application, and they will complete the essay and submit with their application. And we do, let students know that, just the minimum, meeting the minimum criteria does not always guarantee admission. Like I said earlier, our programs are located both on the Troy and the Dothan campus. Traditionally, our traditional age college students, the 21, 22-year-olds are on our Troy campus, and our Dothan campus is usually our more non-traditional students. Both campuses admit every fall and spring with the same admission criteria. We have deadlines for our application process, March 15th and September 15th for fall and spring semesters. Our application is totally online, so it is on our Troy University School of Nursing Bsn Program website, and you are able to upload all information to that application that is needed, and it is sent electronically to our Bsn Program administrative assistants. After admission to our program, we do have certain standards and clinical requirements that our students do have to meet. This is primarily due to our clinical relationships that we have with our local healthcare facilities. So we have certain requirements that each student has to meet annually to be able to attend clinical in our facilities that we utilize. And you can see here some of those are drug screens, background checks, skin testing for tuberculosis, immunizations, and titers. And these are things that we are asked to provide to our facilities that we are guests in. An overview of the courses that you will be exposed to during the nursing program. You can see here we start out with your nursing concepts, introducing you to the field of nursing, and then we move through our adult health nursing, our OB and pediatrics, our psychiatric mental health, and then on into your complex care, which is your intensive care nursing, public health nursing, nursing research, which prepares you for entrance into a graduate program, and also leadership and management. You do get approximately 60 hours of clinical in each course each semester. So you're usually doing about 120 hours a semester of clinical time in the area of the course. And I will turn it over now to Dr. Kelly Whitted, and she will discuss our graduate program at Troy University.
Hello, I'm getting my screen up now, so if you will give me just a minute to get my PowerPoint up. Okay, I'm Kelly Whitted, and I'm the coordinator of the MSN program at Troy University. And at Troy, we have a Master's of Nursing program and a Doctorate of Nursing program. And we also have Postmaster certificates. And those are for students that already have their Master's that would like to come back and get a certificate for another program. We have 2 tracks for our Master's program. Our most popular Master's program is the Family Nurse Practitioner track. We also have a Healthcare Informatics and Nursing Leadership track. And that track, we have students that, some students focus on the informatics piece, and some students focus on the nursing leadership piece. So that track actually has 2 different foci on the in that program. I'm sorry, I was not ready yet. The Postmaster certificates, if you have a master's degree in nursing administration or nursing education, but you would like to go back to become a nurse practitioner, then you can apply for the Postmaster's Nurse Practitioner certificate. To become a nurse practitioner, you have to have a certificate to sit for the nurse practitioner exam. So you would not need a second master's education, a master's degree in nursing. You would just need to take the courses that you need that are required for the nurse practitioner exam, and then you would have the certificate where you could take the nurse practitioner exam. So that's what the Postmaster certificates are. I'm sorry, my slides are progressing faster than I'm talking. The Healthcare Informatics and Nursing Leadership Certificate is the same. It is a certificate that lets you be able to sit for the nursing executive exam if you would like to take the nursing executive exam. And our newest Postmaster certificate is the Nurse Educator Certificate. If you were already a nurse practitioner, but then you wanted to go back and teach, you could take 5 nurse educator courses, and then you could have a certificate in nursing education. And then we also have the Doctorate of Nursing Practice degree. We have 2 clinical focus for the Doctorate of Nursing Practice degree, and that is the Family Nurse Practitioner and also the Nurse Leader. The MSN program, the Family Nurse Practitioner track, is 47 semester hours. And in those 47 semester hours, our students do 705 clinical hours. Now, those clinical hours are divided into 4 semesters. So we have 4 semesters of clinical. The first one is Advanced Health Assessment. The second one is the Advanced Primary Care. That is pediatrics and women's health combined. The third one is Primary Care 2. That is geriatric and adult care. And then the last one is their internship, where they complete 300 of their clinical hours. The Family Nurse Practitioner program can be taken in 5 semesters if students would like to go full-time, or it may be taken in 8 semesters if students would like to go part-time. And for the graduate program, we do take classes during the summer, but not clinical courses. So we offer core courses during the summer, but like Dr. Armstrong said, the summer semester is shorter, so we do not offer clinical courses during the summer. The Healthcare and Informatics and Nursing Leadership program, that is 37 semester hours. Those students complete 480 clinical hours, and that program can be done either in 4 semesters full-time or 6 semesters part-time. And that program does not go during the summer. The Family Nurse Practitioner program is the only program that does go during the summer. The Postmaster certificate, the FNP certificate is 33 semester hours. The students complete the same 705 clinical hours. They are in the same courses that the MSN FNP students are. They just don't have to complete all of the MSN core courses because they already have a master's degree in nursing. The Postmaster's HINL certificate is 23 semester hours. They complete the same 480 clinical hours along with the MSN HINL students. And then the Postmaster's Nurse Educator certificate, that program is 5 courses that are 3 semester hours. So it's a 15 semester hour program. The DMP program, we have 2 options for the DMP program. We have an entry level for BSN to DMP, and we also have an entry level for an MSN to DMP. So if you have a BSN and would like to go back to the DMP program, you need to choose a clinical track, and you can choose the FNP track or the nurse leader track. If you choose the FNP track, you have to complete 65 to 70 hours, depending on how many hours you completed in your BSN program, and it takes 3 years full-time. If you choose the nurse leader track, then it would be 57 to 62 hours, depending on how many hours you completed. I'm sorry, my slides keep progressing. Depending on how many hours you completed in your MSN program or BSN program, and it is also 3 years full-time. Now, the MSN program, if you already have your MSN, if you're already CRNA, midwife, FNP, wanting to get your DMP, then you already have your clinical focus. It is 35 to 39 hours for the DMP program, and that can be completed in 2 years. The Admission requirements for the MSN program: you must hold a BSN from a regionally accredited university and a nationally accredited nursing program. And these are the national accreditations. Like Dr. Armstrong said, Troy University is ACEN. Our master's program was accredited in 2019, so we are accredited through 2017. You must have a current unencumbered RN license in the state where you plan to do clinical experience. You must have taken an undergraduate health assessment course or an equivalent of an undergraduate health assessment course. We require 2 years of professional reference. And if you are applying to the FNP track, then you do need 1 year of experience as an RN for the FNP track. We have a conditional and an unconditional admission status. If you have a 3.0, then you are admitted unconditionally and you may attend the program full time. If you have a 2.5 on a 4.0 scale, then you are admitted conditionally and you will attend the program part-time until you clear the conditional status, and that is after 9 semester hours. If you have a 3.0 after you've completed 9 semester hours, then you have cleared the conditional admission status and you may attend full-time after that. The admission requirements for the Postmaster certificate: your master's degree must be from a nationally accredited program. Same current unencumbered RN license in the state where you plan to do your clinical experience, 2 letters of professional reference, and 1 year of experience if you are applying to the FNP track. The admission requirements for the DMP program: you must hold the required degree from a nationally accredited program. Our ACEN program, the DMP is accredited by ACEN also. It will be up for its reaccreditation in 2024. The admission requirements for GPA is a 3.0 for our DMP program on all graduate coursework, and you must possess a current unencumbered license in the state where you will practice. DMP admission requirements do require an essay, a resume, the 2 letters of recommendation, and all transcripts from all universities attended. All of our applications are online, so on the Troy University Nursing webpage, you will see the Apply Now tab, and you drop down to which program you would like to apply, and everything is online. If you're applying to the MSN to DMP program, you must have a valid certification in advanced practice, whether it's FNP, whether it's midwife, whether it's CRNA, must be from a nationally recognized accrediting body. For FNP, it would be AANP or ANCC. You have to submit documentation of your clinical hours that you had in your program. And then you must have 1 year of experience, again, if you want to do the FNP track. All of our nursing courses are offered online. We do have orientation at the beginning of the program. Now our FNP program does have 2 campus visits. One is the first clinical course where you do advanced health assessment, and one is the last clinical course. We have a suturing lab, and we have an exit exam where we have a practice FNP certification, where it's like preparation for the FNP certification boards. We have a faculty mentored scholarship project for the MSN degree. And like I said, the MSN program is accredited by ACN through 2027. And the DMP program is accredited through ACN through 2024. The MSN program prepares graduates for an FNP certification and advanced practice APRN licensure, or advanced practice certification in nursing leadership, or nursing leadership position in healthcare informatics. Those are our 3 tracks for our MSN program. The DMP program prepares graduates in a variety of leadership roles with a DMP degree. Students have responsibilities as managers for QI, executive positions in healthcare organizations, a lot of directors of clinical facilities, a lot of faculty for nursing programs are getting their doctorate degrees now. And it also prepares FNPs in clinical practice to improve patient care outcomes. And the BSN to DMP program prepares graduates for the FNP certification or either the nurse leader. I am the MSN program coordinator. This is my email and my contact information. Dr. Amy Spurlock is the DMP program coordinator, and this is her email address and her contact information. And I will stop sharing my screen. So the next presenter can share theirs. And would you like us to wait and take questions at the end?
Yes, Dr. Whitted, I think we'll do the student questions at the end, but I would just like to ask both of you very quickly if you can just answer or let us know what sort of funding is available to international students who want to pursue nursing in the US.
Dr. Armstrong, you might know that better than me being on the Troy main campus. We do have financial aid and funding. I'm not real familiar with it with the graduate school. Are you familiar with it, Dr. Armstrong, on the Troy campus?
Dr. Armstrong, you need to unmute them.
Sorry. I'm not as familiar with it because we do not work with the students at that point in admission, but I certainly have the contact information for any students that are interested to contact our financial aid and international office to discuss the funding that we may have to assist them while they're here at Troy University.
Thank you so much, Dr. Armstrong. Before we move to the next segment, just an announcement. Please put in your questions in the chat box or wherever you're viewing it from, and try to be as specific as possible so that it would be easier for us to direct to the appropriate panelist at the end of this session. Now, okay, let's move on to the next segment, which is the medicine. So I welcome Mr. Michael Richards from Keck School of Medicine, University of Southern California. Welcome, Dr. Michaels. Dr. Michaels is the Assistant Director of Admissions at Keck School of Medicine. So over to you, Dr. Michael.
Good morning. It's morning here in Southern California. Thank you for having me. I'm really happy to share information about our medical school MD program, as well as just general information about MD programs in general for you this morning. I'll share my screen here. I have a little PowerPoint slide. Just a moment. Okay. So I am the Assistant Director of Admissions. I am not a doctor, actually. I work in the admissions office. I do outreach at events like this. I speak to pre-health, pre-med students, mostly in the California area, about getting into medical school and trying to give them tips to make themselves successful applicants to medical school. So a lot of the information I'll give you, hopefully you can apply to whatever program or academic endeavor that you embark on. Hopefully you'll have some things that you can take away from this and use in your career. So with that, I'll get started. A little bit about Keck School of Medicine. We're on the Health Sciences campus of the University of Southern California, which is about 10 minutes east of downtown Los Angeles. The main campus is in a different part of town, but very near the downtown LA area as well. But we're on a separate campus. And basically, the Keck School of Medicine is comprised of three kind of organizational units. One unit is involved in patient care. We serve over, our faculty physicians serve over 1 million patients annually. mostly at our main training hospital, which is the LA-USC County Hospital of Los Angeles. That hospital is probably one of the most diverse patient populations in the country. Many of the people that come there for healthcare can't afford to pay for healthcare. So we feel like we provide a very valuable service in this area in that way. We also, excuse me, have affiliations with Children's Hospital of Los Angeles, the Norris Cancer Research Hospital, which is a National Institutes of Health Center of Excellence in Cancer Research, and a number of other different clinics and hospitals in the Southern California region. So we have a really big footprint here in Southern California healthcare, along with other schools as well. UCLA is in the area, and UC San Diego, UC Irvine, all fine medical schools that provide really great healthcare. We have student training. We have a really, like I said, a really broad network of training hospitals. We have a number of different master's programs that are affiliated with the Keck School of Medicine, and all of the medical sciences. We have about 8 different PhD programs that train scientists. We have over 30 different research centers that are affiliated with the Keck School of Medicine. So it's a really vibrant, collaborative community of physician scientists on our campus. Very, very, very lively, dynamic institution. So the program that I represent the MD program, and we have a couple of affiliated programs, the MD MBA program, which is Masters of Business Administration, the MD MPH program, which is Masters of Public Health, and the MD PhD program, which is an affiliation with Caltech University. We also have a School of Pharmacy on our campus. The School of Dentistry is not under the Keck School of Medicine, but under USC, and they're on the main campus. We have also occupational therapy. We have a number of different programs that are housed on our health sciences campus. You can visit our website at keck.usc.edu to see the different programs that reside on our campus. We have 2 undergraduate programs that come under biological sciences and preventive medicine, 13 different master's programs, 8 different doctoral programs. So it's a very dynamic student population, very, very robust academic environment. Just a few things about our program. Many universities, many medical schools have a pretty extensive list of science courses that they require that applicants have before they apply to the program. We do not have any prerequisites. We don't require any prerequisites, but I'll talk about what other schools typically require a little bit later in the presentation. We use a holistic evaluation method. That means we look at all of an applicant's application materials. We look at your academic background, all of your coursework, of course, your test, your medical college admissions test, your GPA, and we use that information to come to a determination of whether or not you'd be a good fit in our program. Our program, basically the curriculum is delivered through organ system instruction. We start our incoming students off with 19 weeks of foundations in the medical sciences that will cover like biochemistry, microanatomy, excuse me, immunology, all of the foundational medical sciences. Then after that, you will progress through each organ system, such as cardiovascular, musculoskeletal, neuroscience, renal, and so on. And that's the first 2 years of medical school. Each organ system is about 4 to 6 weeks long, and each system culminates in a pass-fail exam at the end of the block of instruction, which really facilitates and encourages a lot of collaboration with our student body. We have a small learning communities. Basically, we divide our cohort of 186 students into groups of 24 students, and we assign them 2 faculty physicians, and that's kind of like their home-based group for the first couple of years, for the first 2 years of their medical education. We also have a doctor-patient relationship skills program that we start in about the 3rd week of medical school, and that runs for the first 2 years as well. And in that component of the curriculum, students are broken off into cohorts of 6 to 8 students with 1 faculty physician, and they shadow that physician in our training hospitals. They learn how to communicate in settings of illness. We have simulated patients come in. They learn how to take histories and make fundamental diagnoses, learn how to clinical reason with patients. And this is all in coordination, integrated with our curriculum, with wherever they're at in our organ system curriculum. So those are just 2 kind of components of the curriculum. There are others. If you would like to visit our website at keck.usc.edu and look under admissions and curriculum, you'll see a full description of our curriculum there. We have a really big academic support unit. We have licensed or a PhD learning specialists that are available to our students. They provide comprehensive support. They train our higher students, like our 3rd and 2nd years. They're paid and trained to tutor our 1st year and 2nd year students. They provide academic planning, mentorship, things of that nature. So it's a very, very supportive environment. And we also have a very robust student wellness program as well. And that's led by 2 licensed clinical psychologists that are available to our students. They meet with every one of our students every academic session, and just to check in with our students. They provide different wellness activities like meditation, exercises. They have meet and greets and things like that to keep everybody kind of plugged in socially with one another and supportive of one another. And that's a big part of our program. This is kind of a little snapshot of our class. Our class size is 186 students. Our last incoming class, we had folks from 8 different countries of origin, including Canada, India, France, Germany, Italy, Spain, you name it. Like we've got people that have ties to a lot of different countries around the globe. Over 33 different languages spoken by our student body. Our average age of our students, 24 years old. The range is about 23, I think, is our youngest student. The oldest is in the mid-30s. Pretty balanced male-to-female ratio. Our median MCAT is 517, and our median GPA of our last incoming class was 3.70. We don't have a Baccalaureate Md program, but I was asked by the host to talk a little bit about that because there are some programs in the US that do have that type of program. A Baccalaureate Md program is a program where the undergraduate is partnered with the medical school program so that a person can enter their undergraduate career already predetermined to be a medical student if they meet certain criteria. There are about 40 different medical schools in the US that offer that option, and the time length varies. Some you have to commit like right out of high school when you get into the undergraduate program. Others you can commit as a junior, and then you continue on and, from after undergraduate and complete the medical school training. The thing about those programs is that you have to really declare. It really kind of curtails your career exploration. So we had that program until about 4 years ago, and we discontinued it. It just didn't seem to work for the way we train our MD students. So, but for people that have foreclosed on a career in medicine, it could be a great program. The academics distinction is very important. So you have to really keep up with your academics. You have to demonstrate a strong commitment to the medical profession. One of the big fears of medical school reviewers that review applicants is that applicants haven't really done their due diligence in exploring their careers, and they're a little unclear or maybe have unrealistic expectations about what the medical profession might be like. So it's very important that applicants be able to demonstrate that they have a strong sense of what they're getting themselves into in applying for medical school, and what the challenges are that lie ahead for them. Also, a strong record of community service. One thing that's difficult for a baccalaureate MD person is to keep up with the heavy academics that's involved, while being engaged in their community of interest, and like volunteering and extracurricular activities that really round out a medical school applicant. So that can be very challenging. So it's a great pathway into the medical profession if you can manage it. But you have to really kind of go in with your eyes open and understand what the challenges are when you enroll in a program like that. I just wanted to point out that we don't have the BAC MD program, but we do have a progressive degree program at the University of Southern California, where you can tie your undergraduate work to a master's degree in any of these fields here that you see on the screen. And basically the way it works is you have to have at least like 64 units of undergraduate coursework, no more than 96 units of undergraduate coursework. So you'd enroll in the program as a junior, and then you'd go right in. Once you complete your undergraduate work, you would go right into the master's degree coursework. And most master's degrees are 1 to 2 years in length. So that would make your total education there at USC, anywhere from 4 or anywhere from 5 to 6, maybe 7 years, depending on the length of the master's degree. I did mention earlier that we do have an MD MPH degree and MD MBA degree, and basically the way that works is our medical students that are in their second year of medical school in academic good standing, they can apply to either one of those programs at the University of Southern California. And what would happen is after year 3 of the medical school curriculum, they would go to, like say if they were going to do an MPH, a Master's of Public Health, they would then go and do that a whole year of MPH coursework, complete that, and then come back and complete year 4 of the medical school curriculum. And after 5 years, they would graduate with both degrees. And that's the same way, works the same way for the for the MBA program as well. The MD PhD program is a different kind of program. You would apply to that directly, when you apply to our medical school, our MD program. And basically that's in conjunction with Caltech. So if you're accepted into that program, any of the PhD programs that are offered at Caltech and any of the PhD programs that are offered at the Keck School of Medicine would be available to you. And basically you would apply to the program, and if you're accepted, we usually get about 200, 250 applications for that program. We accept about 4 or 5 applicants. It's fully funded, and we provide a $35,000 a year stipend for all of those accepted MD PhD students. And basically they do the medical school curriculum for the first 2 years. In the summers of those first 2 years, they will do lab rotations in various labs, both at Keck and at Caltech. And then after the first 2 years, they would choose what their research topic would be and which lab they wanted to work in. Then they would go, and the PhD portion can be anywhere from 3 to 7 years, depending on what type of research they do. They would complete that and then come back and complete years 3 and 4 of the medical school curriculum. So it's a very lengthy, very lengthy, comprehensive course of academic instruction, but it's a great program. If you love research and you also love the clinical aspects of being an MD, then it is a great thing to consider. Just a little bit about general medical school requirements. Like I said, we do not require any prerequisite coursework to be eligible to apply to our MD program, but many medical schools do. And this is typically what they require, like biology, physics, chemistry, biochemistry, English, and usually statistics. So I think one of the misconceptions about being a medical school applicant is that you have to major in the sciences as an undergrad, and you really don't. You can major in whatever course of study that appeals to you, as long as you develop a great foundation, a strong foundation in the basic sciences. So you could be a music major and do well in these science classes and present as a very viable MD candidate. So I like to encourage people that are, have a leaning towards liberal arts. You can major in a liberal arts program and still become an MD. It seems like every year we have a growing number of people that were English majors, music majors, what have you, sociology majors that come in that have done their science coursework. Some of them will complete a post-baccalaureate program in the sciences to kind of get their foundations in the sciences up to speed, and they make excellent medical school applicants. So that's something to keep in mind. So our selection process, we receive, I'm sure you know that the medical school MD application process is very competitive. We already have 8,500 applications so far this year. We've kind of broken our own record here for 186 spots. So it's a very competitive process, particularly here in California. So I encourage people to apply in a targeted way, but broadly around the country, because California is I think we have like 9,000 applicants for California medical schools and about 6,000 spots. So it's very, very competitive process. Our application process is such that every applicant that submits a primary application through the Association of American Medical Colleges gets a human being to look at their application. We don't have any artificial cutoff scores or anything like that. Every applicant is reviewed holistically. We invite about 750 or so people to interview with us. This year, because of the COVID-19 pandemic, all of the interviews are Zoom interviews, and basically they're traditional interviews. Our interviewers don't know anything about the applicant, and basically our applicants will interview with one faculty member and one student. And those interviews are very, very low key, just to kind of get to know you type of interview. We've already decided when we invite you to interview that on paper you look like someone we want to have in our program. So we're not just playing around when we invite people to interview. We hope that you will successfully complete the interview and join our program. So our interviews are very, very, very low key. You know, like I said, it's just a very congenial environment, and we do everything we can to help our applicants relax and do as well as they can in the interviews. We actually accept almost 400 students out of that pool of interviewed applicants. And it works out that a lot of them will go to other schools, and we whittle down to our number of 186 students that matriculate into our incoming class each year. These are some of the things that medical schools look for. You know, it looks kind of like boilerplate items, but these are what they look for in your application. They want to see where you've developed, where you've given yourself an opportunity to develop integrity and ethics, service orientation, capacity for improvement. In your primary application, you'll have 15 different spots or spaces in your application in your experience section to list all of your extracurriculars and work activities, and you can write a short paragraph about your experience with those activities. And reviewers are expecting these things to be, you know, discussed in some way. When you talk about your experiences, they want to see that you've consciously worked to develop these competencies. So that you know, in applying to medical school or any graduate level program, being able to kind of talk about your experience and your values and your sense of mission in these terms will be very valuable, because a lot of applicants that are not successful, they might be great candidates, great people, great students, and you know, might go on to be great professionals, but they lack the ability to talk about themselves in these terms in a compelling way in their application materials and then later in the interview process. So I encourage you to visit the AAMC's website. Excuse me, they have a full descriptions of each one of these items there. And it's definitely worth paying attention to that and trying to incorporate that in your approach to applying to medical school. Just some tips, general tips about preparing for medical school. You definitely want to have a great support network. You want to work closely with your pre-health advisors. That is a must. They know a lot about a lot of different programs around the country. And they can give you insight into how to approach your application process with particular schools. So it's important to work with them closely. And one thing that I've really begun to notice is that a lot of advisors, you know, are kind of hesitant to be candid about an applicant's viability as a medical school applicant. So you want to make sure that your pre-health advisor is being honest with you, giving you an honest appraisal of your ability or your viability as a medical school applicant, because you don't want to waste a lot of money applying to schools where you're probably not a good fit for. So, and your pre-health advisor should be the one to help you make that determination. Another aspect of this.
Sorry to interrupt. We are running a little low on time. We have a lot of questions also coming in. So maybe if you can just finish in the next couple of minutes, we'll.
I sure will. Okay. Sorry about that. These are just some resources that you might want to take a look at. Medical School Admissions Requirement Handbook has every medical school in the U.S. There. It shows all of their prerequisites that they require, different information about their incoming class, metrics, and things like that. The National Association of Advisors to the Health Professions are the professional development body for all pre-health advisors in the US, and they provide free pre-health advising as long as you don't have a pending application, medical school application, Keck School of Medicine's website, and our Dornsife College of Letters and Sciences, which houses the majority of our sciences programs. And I'll conclude with that.
Thank you so much, Michael. Before we move on to the student questions, I just wanted to ask you this, because there are many students, who approach us, and many of them who are here would be wanting to know this. So what about the students who finish the high school, grade 12 in India? What is the pathway for them to pursue medicine in the US? If you can very briefly touch upon this, we will then go back to the student questions.
Yeah, most medical schools require that all applicants have earned a bachelor's degree, the equivalent to a U.S. bachelor's degree, by the time they enter the MD program. So you can apply in your undergraduate years, but you must finish your undergraduate program by the time you enter the program. And as far as international students, basically what would happen is different medical schools have different ways of doing it, but they would require that you submit to them your evaluated transcript so they can determine whether or not your undergraduate coursework was equivalent to a U.S. bachelor's degree. We would do that at the Keck School of Medicine's MD program. We would ask for that. If we invited you to interview with us, we would ask you to supply that so that we can determine the equivalency of your undergraduate education.
Okay.
Did that answer your question?
Yes. Thank you, Michael. I think we'll take some questions, and there are a few more questions about the similar aspects. So here we go. Here's the first question that we have. I think this is for Michael again. This is it advisable for an international student to opt for an integrated medicine course, which takes about 6 to 7 years? That couldn't hurt as long as you do well in the course. But I tell people, don't do anything for medical school that isn't of genuine academic interest to you. Because what's going to make you a really great candidate is that you have a vision for your future, and that you have you can demonstrate a consistent push to accomplishing whatever goals you set for yourself. And so don't just enroll in programs to look like a better medical school applicant. Enroll in academic enrichment programs that are of genuine interest to you, and so that when it comes time for you to talk about those things, you can really make a compelling case for the role that's going to play in your academic and professional life. Thank you, Michael. If you have any other questions for any of the panelists, please put them in the chat box. So we are getting to the question and answer component now. So next question is, I think this is directed towards Dr. Alma and Mrs. Campbell. How many years it takes to complete the DMD for someone who is in high school, currently studying grade 12 in India?
I'm gonna probably reverse this to our Assistant Director of Admissions, Jamie.
So if they are, so remind me one more time, I want to get it right. So they're in grade 12.
The student who's currently studying grade 12 in India, how many years will it take for him or her to complete DMD in the US?
Typically, there's always things that could go either way. Typically, that would be 4 years of college work and then 4 years. So that is the one that can vary. Sometimes students graduate early, sometimes it takes them longer. But if they're going the direct traditional path, 4 years of undergraduate work and then 4 years of DMD, of dental work.
We have, I think you can very quickly answer this. This is from one, okay, he says, I want to ask a very simple question. What does Casper mean?
Oh, don't ask me that. Let me look it up.
Casper is really
Something.
a situational judgment test.
Yeah.
So it's an online test that judges your actually non-cognitive approach. So it's the ethical and non-cognitive test, really. So we have several situations that are presented to the candidates, and then they have, I think, 10 minutes, Jamie, to answer those questions. So you'll present the situation. You have to evaluate. So there is no right or wrong answer, but it's just evaluate your non-cognitive aspect.
Yeah. The acronym stands for something, but it's long. That's why they've shortened it. Yeah.
This is again, I think Dr. Alma can answer this. What's the process for a student who already has international dental degree and wishes to pursue dentistry in the US?
We have that program as well, and I was privately chatting with one of the applicants in the chat room. We have something that is called Advanced Standing Program, and that is a program that they would apply to. And I'm again gonna have Ms. Campbell give you directions how to apply to that program.
Yes, for applicants that have their dental degree in another country, they would be eligible for what's called advanced standing. So for our program, they would enter our program in the fourth semester, and then essentially be completing 2.5 years of dental work. So that does happen. That application for us, it doesn't happen every year because it's only based on space available currently, meaning that someone would have to leave our class and then we would have to have space open up. Other programs throughout the country reserve spaces for advanced standing students. But for ours, that application typically begins in, I think it opens in March, and then it ended in July of this year. And we just completed interviews. This year we did have 3 spots, but that doesn't happen every year.
I think the next question, Dr. Whitted can answer this. Dr. Whitted, student says, I've completed my master's in nursing with OBG specialty. Now I'm interested in pursuing PhD. He's just asking about, general requirements. Is he eligible to do a PhD in the US? What's the funding? Will there be a funding available?
Yes, we don't have the PhD program at Troy. There are PhD programs, but we don't have a PhD program at Troy. We have the Dmp program at Troy as our doctorate, but there is funding and there are PhD programs in the US.
Thank you. Michael, you were going to say something, or you're going to add something to it? You're muted.
Sorry, I thought the question was for me. I'm sorry.
Okay, so the next question is again to School of Nursing, Dr. Amma. I also have an MPH degree from Australia. I have a question around Advanced Standing Program after NBED, and I'm inclined towards dental research. Is there a dental public health program or any research oriented with University of Louisville? He's asking that essentially.
Yeah, actually, that was the question we privately chatted. So I think we resolved that. There is really no, not that I know of, advanced standing program for the non-clinical, but definitely research options are available. And there is master's program that you can go into and get a master's degree that route. And there also was chat about, faculty positions. You don't have to have a DMD degree to be faculty, but depending which faculty position you're applying for. So if you're applying for a faculty position, for a clinical faculty position, obviously you have to be current in your clinical skills. So the research program will not make you competitive. If you are applying for a tenured position, that's a different option. Again, it's a luck of draw, if it's very competitive process.
Okay, next question from Tejaswini, again, directed towards you guys. Is how will we validate our international graduate degree in dentistry in the US? And what postgraduate courses are we eligible after our degree is validated?
For someone who, does this person already have a dental degree, or is that for?
Yes, somebody who has a dental degree and a PhD, a postgraduate program in the US?
We don't look specifically at the prerequisites for someone who already has the dental degree. We do require the ECE or the WES evaluation, but we're not going to go in and do the kind of credit to credit like we would someone applying the traditional method with a non-dental degree. So they would not be required to take additional coursework. I think that's what they're asking in the US.
Thank you. Michael, I think this is for you. Is it possible to do biomedical engineering as a major and a minor in pre-med in undergrad? Will it have any effect on preparing for MCAT? And he's also asking the rate of acceptance to med schools for international students.
Yeah, a lot of our, I'd say about 60% to 70% of our incoming class majored in the biological sciences, but a large part of that constituency or biomedical engineering majors. So that's a great, I think that's a great major that kind of help you prepare for the hard sciences in the MCAT. But that's definitely something you want to visit the AAMC website, and they have a full description of what's the content of the MCAT, and you want to look at that content to kind of gauge, where what programs would prepare you best for those topics. And what was the other part of that question, Suhail?
Let me just, what is the acceptance rate?
Oh, we get, I'm not sure of how many students we get, but very few international students seem to get into the MD program, our MD program. And I think one of the reasons is the preparation. I think a lot of people focus on the grades and the metrics at the expense of establishing service orientation, extracurriculars, and kind of a well-rounded kind of academic and professional body of work. So I think that kind of hampers a lot of international students that apply to our program. I think last year we accepted maybe 1 or 2 international students, and I think those students that have strong ties to our Keck research or academic community are more likely to kind of know what it takes to be a Keck type of student, and I think they would fare better than most other international students.
Thank you, Michael. I mean, we are almost out of time. Is it okay if we just 5 minutes? Is that okay with the panelists?
Yes.
All right, let me just go to the next question. So again, this is directed to the School of Nursing, Dr. Whitted. Again, it's a PhD question. I think he's asking in general, is there any experience that is needed to do my nursing, a PhD in nursing in the US?
No, not a PhD program. You have to have experience to get into a nurse practitioner clinical track, but not into a PhD program, usually not. But that would generally apply to the school because each school is different. So it would more so go with the admission requirements for the school rather than the program itself.
Thank you, Dr. Whitted. This, again, I think Jamie can answer this. I suppose, can an international student with dental degree pursue MPH, Masters in Public Health course?
I think so. I don't know the requirements for our public health, but I can, while we're here, I can type in the information for our graduate public health advisor here at U of L, but I'm not familiar with what the requirements are for entry into that program. But I can look for her contact information and share that.
Sure. Please, write to us, or you can reach out to Jamie or to the school. We will forward the question as well. So let's move on to the next question. Michael, the student is asking, I completed my MBBS and then do I give US MLE and then apply for residency? I think the student is asking about the pathway. Somebody who's doing their MBBS in India, studying MBBS here to do residency in the US.
Oh, yeah, that's going to vary from program to program. Please visit our keck.usc.edu website, and if you search on residency programs, you'll get more information about that, because I'm not sure what the qualifications are for that. Also, the AAMC.org website, they have all of the information on residency applications there, so you can check those places.
Okay, on the similar note, Michael, we have a very similar question here. If my daughter completes her MBBS, which is equivalent of MD in India, would she apply for what program would she be eligible, or what can she do after finishing her medicine in India?
As far as practicing medicine in the U.S., she would have to get a medical. She would have to get a license to practice medicine in the U.S. As far as like an MD program goes, like I said, our qualification is that an applicant would have to have the equivalent of a U.S. bachelor's degree, and assuming that she did, she would have to apply as a first-year medical student. She would have to apply to enter as a first-year medical student. We don't have advanced standing.
All right, thank you. So again, to Keck School, is there an option of a student exchange program in Keck School of Medicine for undergraduate student from another country?
Not at the Keck School of Medicine as far as like the MD portion of our program, but yeah, if you visit the usc.edu website, they do have foreign exchange programs and partnerships all over the world with different academic institutions. And yeah, it's very, very possible to do some type of exchange program.
I think we can take one last question, or maybe two questions. So this is directed towards the School of Nursing, Troy University. So the question is, the student has completed optometry in India and now wants to pursue nursing course. Is he eligible?
I'm sorry, the student has completed what?
Optometry.
Is that like a bachelor's degree?
That he didn't mention. I'm presuming it is a bachelor's degree.
If the bachelor's degree
is,
if the bachelor's degree is accredited, then they would be able to apply for the master's program, but it has to be from an accredited program.
Okay, right. All right, I think, we have covered most of the questions, and some of the questions are repeating. So I would request everyone to please make a note of our website, which you can see on the screens, EducationUSA India at usif.org.in. If you have any other questions about studying medicine in the US, or if the pathway for any of these programs, any other questions also, please do write to us, and we can schedule an appointment and discuss with you in detail, or we can also direct these questions to the appropriate panel who has participated today. With that, before we close, I would just like to tell you that, on your screens, you can see the other Discovery Series programs that are going to come up now. So please, again, take a screen grab, or you can visit our social media or website to know more about these sessions, and you can register for these. And also another announcement is, we have undergraduate virtual fair coming up on October 9th and 10th. If you haven't already registered, please do register. We have 150 universities that will be present. You can directly interact with the university representatives there and talk to them about all the programs, any program, in fact, including all the programs that we discussed today. So please make sure that, you register for this fair and attend this as well. So with that, we'll, wrap up today's session. I would like to thank all our panelists for joining in today and taking out time. I know it's very early, for you in the US, and thank you so much, for answering all those questions and, doing a great presentation. So if you have any questions, we will probably direct them towards you. So please do write to us. Thank you so much.
Thank you.